Hello and welcome to my channel. I'm starting a new series on pharmacology. So let's look at the definition of pharmacology. What is it all about? Now, pharmacology is the science that deals with the interaction between living systems and molecules, especially chemicals introduced from outside the system. So let's write this down. So the definition. So we're going to say pharmacology is the science that deals with the interaction between living systems and molecules, especially chemicals introduced from outside the body. Or we can say from outside the system. Okay. Now, this includes what we call medical pharmacology. Okay. Basically, medical pharmacology is a science of materials used to prevent, diagnose, and treat diseases. It also involves chemicals in the environment that cause disease and the use of certain chemicals as molecular probes for the study of normal biochemistry and physiology. So that's what medical pharmacology is all about, right? So the science of materials used to prevent diseases, okay? Science of materials used to prevent diseases. So that's one use of it. And as we said, it also involves chemicals in the environment that cause disease. And then the use of certain chemicals as molecular probes. Now, for the study of normal biochemistry and physiology. Okay, so that's what medical pharmacology is about. Okay, now the other branch of pharmacology is what we call toxicology. toxicology. Okay, so toxicology deals with the undesirable effect of chemicals in biologic systems. So this involves the undesirable effects of chemicals in biologic systems. Okay, so that is what toxicology involves. Now we want to look at the meaning of what a drug is. So what is a drug? What do you consider as a drug? So when we say a drug, we are talking about any small molecule when introduced into the body alters the body's function by interactions at the molecular level, right? So that's what a drug refers to. Okay, any small molecule when introduced into the body alters the body's function by interactions at the molecular level. All right, so that's what we refer to as a drug. So this includes things like hormones. Okay, hormones, whether introduced from outside or released internally in increased amounts by administration of a stimulating agent. Yeah. When we introduce hormone from outside, we refer to it as exogenous, in origin. So let's write this down. This includes one, hormones. Whether introduced from outside. So that's going to be exogenous. Or released internally. In increased amounts. By administration. Of a stimulating agent. Okay, so hormone is an example of a drug. Now, secondly, you could also have poisons. Okay, Poisons are also drugs. So whether administered with criminal or suicidal intent or encountered inadvertently in the environment. Okay. So poisons are also drugs. So let's write it down. Whether administered with criminal or suicidal intent. Or encountered inadvertently in the environment. Right. So that is a definition of what a drug is, and that when you're dealing with pharmacology, right? Now I want to look at the different sizes for drugs. Okay, drugs come in varying sizes. So drug sizes. Okay. No, it's okay. So they are variable. They vary in molecular sizes. Okay. It could be small, so you can have very small sizes. For example, if you take something like carbon monoxide, CO, carbon monoxide, or lithium ion, right? Li plus lithium ion. They are very tiny, very small sizes. Or you could have large sizes, large molecules. For example, if you take something like thrombolytic enzymes, they are large proteins. Thrombolytic enzymes, right? So they vary from small sizes to large sizes. Okay, but most drugs will have a molecular weight between 100 and 1,000, right? Most of the drugs. So most drugs will have a molecular weight of 1,000 to 100 to 1,000. Molecular weights between 100 to 1,000. All right. Okay. Now, what's the nature of the drugs, the chemical nature? So let's talk about the chemical nature of drugs. How do they look like? The chemistry of it. Again, they vary in their chemical nature. They vary. Okay. We have those that are highly reactive, they're highly reactive chemical agents. Example would be like the alkylating agents such as the mechlorothamine, mechlorothamine, very reactive. So you could have highly reactive chemical agents. Example, the alkylating agents. Such as merchlorothamine. And we could also have those that are inert. Okay? They are less reactive or non-reactive agents. So inert chemical agents. Example would be anesthetic gas, such as xenon. Okay, so xenon is a non-reactive agent, or it's an inert, one of the inert gases. So it doesn't react chemically. And then the last group, or last chemical nature, will fall under various classes of organic compounds, such as carbohydrate, lipids, and proteins. So we have various classes of organic compounds. So we can talk about the carbohydrates. We can talk about the lipids. And then we can talk about the proteins. Okay. So these are the chemical nature of drugs. I'm going to add one more. We could also have those that are weak acids or bases. We have weak acids or bases. So we see varying chemical natures. Now let's talk about how drugs interact with our body. How do drugs interact with our body? So we're going to say drug body interactions. We group this into two different categories. One, we're going to talk about what we call the pharmacodynamics. And the second one is going to be what we call the pharmacokinetics interactions. Pharmacokinetics. Okay, so those are two broad interactions. Okay. So what is pharmacodynamic interaction? Now, the pharmacodynamic interaction, this deals with the effect of the drug on the body. How does the drug affect the body? The effects of the drug on the body. Good. So study about this is known as pharmacodynamics. Okay. And then when we say pharmacokinetics, we're talking about the way the body handles the drug. How does the body handle the drug? Right. So that's what we call the pharmacokinetics. Pharmacokinetics. So let's talk a little bit about the pharmacodynamic principles. What does it consist of? So the pharmacodynamics principle consists of one, the drug receptor concept. So we have the drug receptor concept. How does the drug interact with the receptor at the surface of the cell? And then secondly, we have the dose response relationship, how that changing the dose affects the body. We see the dose response. Okay, changing the dosage, how does the body respond to it? So the dose response relationship. Those are two principles that we'll be focusing on in the next lesson. Okay, and then the pharmacokinetic principles consist of the following. We have absorption of the drug, distribution, metabolism, and excretion. That's what goes under the pharmacokinetics. So let's say the pharmacokinetic principle consists of absorption, distribution, metabolism, and excretion. Okay. So what is absorption? Absorption is simply the movement of the drug molecules from the site of administration. All right, that is what absorption is about. And when you talk about distribution, you're talking about the movement of the drug molecules between different parts of the body. And when we talk about the metabolism, we're talking about breaking down of the drug. And then the excretion involves getting rid of the drug from the body, getting rid of the drug from the body. So we're going to end here for now. We're talking about how the drug permeates or enters the body from the site of administration in the next video. Hope to see you soon. Bye-bye.